Hello, my name is Dr. Ben Thompson. I am an audiologist and founder of Treble Health. In this video, I want to cover an important subject that affects our tinnitus community so much, which is the ability to fall asleep and get good night's sleep despite having some sound, having some ringing or other types of sounds in the ears. In this video, I will cover the best sleep techniques for tinnitus and how patients in our community are getting better and able to get back to normal sleeping patterns. The two major questions I have to start for you, if you're someone who has tinnitus, are: is it affecting your sleep? Is it harder to fall asleep or to stay asleep? Ask yourself, how many hours are you able to sleep on average? And do you need any medications or herbal supplements that you're currently using to help you sleep? Before I go into detail on the different techniques that have helped, let me first introduce myself. Again, I am Dr. Ben, and this is my YouTube channel. If you are new here, please subscribe by finding the red button below. Before we go into the details of this video, I would like to explain a bit about myself. I started Treble Health, which is a company that is designed for the tinnitus community to help you get better and to help improve the symptom in the head, in the ears. Now, when I first started, I was coming out of California and became a tinnitus specialist over many years, where we had patients coming 4 hours from the mountains down to the clinic where I worked at in California, and I realized there must be a better way. So I started a company where we provide telehealth, one-on-one Zoom consultations. And since the origin of that company, now we have 7 audiologists that are helping our community with one-on-one tinnitus subscriptions and Zoom consultations, typically over a period of 3 to 6 months, to help promote the process of habituation. What is habituation? It's the brain's ability to reduce the perception of sound over time. Think about the sound of my breathing, the sound of your breathing in and out of your nose. Take a breath, you can hear it if you listen for it. But the brain has habituated to that sound. It doesn't pay attention to it unless I'm bringing it to your attention, unless I'm asking you to pay attention to it. So the sound of tinnitus can be processed in a similar way. Over time, the brain learns to defocus from that sound because it recategorizes that sound from a potential threat, something dangerous. Through the brain, it can automatically and over time retrain itself to realize that sound itself is not a threat. It may be unpleasant, it may be annoying, but it's not a threat. And over time, that can reduce the perception of the sound. During that process, tinnitus usually gets softer too. Now let's talk about sleep. The average person should be getting between 6 to 8 hours of sleep per night. That's no different for you if you have tinnitus. In the first few weeks or months of tinnitus, especially when it's sudden onset and bothersome, it's common to have trouble sleeping and insomnia, which can bring us to sleep hours of sometimes between 2 and 5 hours a night. Now that's bad. That's something that we want to improve. That's definitely something that you should take action on trying to get help for. It's common in our community for patients who are going through that process to have insomnia and anxiety during those first few weeks to months. We can come in and help you, and I want to explain some of the tools that are available to get you started. Number one is taking an audit and looking at the 30 minutes or the 1 hour before you're trying to fall asleep, and make sure you're not looking at screens on the internet, watching TV, exciting your brain, exciting the nervous system. You do not want to be watching an action movie, going on an online tinnitus forum, looking at your bank statements, things like that. You don't want to be causing an emotional reaction in your system for the 30 or 60 minutes before you try to fall asleep. That's step one. Step two, when you're actually in bed going to sleep, have a good sound therapy plan, whether it's a sleep headband or a good sound machine. We like the company Sound Oasis. Next to your bed when you're falling asleep, have that going in the background to help you stay calm and be able to drift off into sleep. Step three is focusing on breathing and relaxing the body. There's a few different ways to do this. I want you to experiment and find something that works. Of course, that's what we do of guiding our patients to try different methods, starting with the ones that work for most people, and then work your way down to find something that does work for you. If I'm working with you one-on-one, for example, I would advise you start by learning how to do progressive muscle relaxation and how to do long, deep, slow breaths into your stomach. That calms the nervous system of the body. There are different elements of the body that are contributing to the mind's hyperactivity. When I have insomnia, sometimes it's related to anxiety. And if I have tinnitus and insomnia, there's probably some anxious mind elements going on. Sometimes we call this the monkey mind because it just keeps going and going and going. It's not going anywhere and it's not actually helping us, but it's bouncing around these negative thoughts or these anxious thoughts in the head. And that affects the body, which is in a fight or flight state, because the body is reacting based on the thoughts. The body does not understand that it's actually calm. There's no actual threat around us. So when the mind and the body can calm and settle, then the body and the brain can go to sleep. I want you to work on breathing techniques. When you're laying down in your bed, that's a good time to use them. And before you go to sleep, focus on breathing techniques like meditation. Reach out to a specialist like us if you want help with what kinds of meditation, what kind of breathing, the exact details. But really, again, focus on the breathing, settling the mind, settling the body, and that will be part of what gets you to sleep. Now, if you're struggling to fall asleep at that point, you may have already tried or are trying medications for sleep, prescription medications for sleep. Overall, I'm a fan of prescription medications for sleep if you're someone who is using them to reestablish healthy sleeping patterns. Your medical doctor is your point of contact for these types of questions around what kinds of medications are right for me and my medical history. Just know that no medication itself has been clinically shown to reduce tinnitus. So if something that you're taking has an effect of reducing tinnitus, it's probably an indirect effect because the medication can improve your sleep and insomnia, or the medication can improve your anxiety or stress, and in effect, that will reduce your tinnitus. Now, what kinds of medications are safe for sleep for tinnitus? Almost all are. What kinds of medications can you get over the counter for tinnitus? Well, there's no medication that we recommend that you should use for over-the-counter use with tinnitus to go to sleep. We have interviewed another medical doctor on this YouTube channel, Dr. Jamie, who did have good things to say about magnesium. That would be a question I would ask my doctor if I'm in your shoes, and an audiologist like myself can help guide you along the way. However, when you're looking at medications or herbal supplements for tinnitus, do not just take anything you see advertised for tinnitus. There's very poor regulations around advertising. So take that seriously. Use medications to help, under your doctor's guidance, establish normal sleeping patterns. And then from there, once you've had consistency with your sleep, you can taper off those medications and still maintain your gains of good sleep. That's what I would do if I was you. If you are enjoying this video so far, I do want you to watch until the end. And right now, I will introduce the Ultimate Tinnitus Guide for 2022. Each year, our team of audiologists comes together and creates an updated guide on tinnitus research, technology, devices, and sleep techniques that can be used for your tinnitus. Check the description below this video to find the Treble Health Guide for tinnitus for 2022. We're not done here yet because sometimes people have no problem falling asleep, but they have trouble when they wake up in the middle of the night and all they hear is the loud ringing and they can't fall back asleep. Now, it is a different element here. There's definitely different mechanisms happening in the body for why someone could have an easier time falling asleep than staying asleep. But what you need to know is that when you wake up in the middle of the night and you're trying to go back to sleep, there's a few tips that I have for you. And this is coming out of research from cognitive behavioral therapy for insomnia, right? It looked at what are the behaviors you can take that have been shown to improve sleep patterns and insomnia. Number one that I have for you, if you wake up in the middle of the night, you try to go back to sleep, if you've been trying to sleep for 20 minutes or so, that's when you have to stand up, go to a different room in your house where it's quiet and it's dark, sit in a chair and just focus on your breathing, and you're purposely staying awake because you're sitting down in a chair. That's not where you want to fall asleep, but you're going to a different room. After 20 minutes of trying to fall asleep, you're going to a different room. You're sitting up in a chair. You can keep your eyes open. You can keep your eyes closed. Sit there until you get tired. That might take half an hour. That might take an hour. That might take 10 minutes. But what the research shows is that's more effective for how to get tired again than trying to just lay in your bed tossing and turning. So that means when you've woken up, gone to a different room, and then you're sitting up in a chair and you're waiting until you get tired again. When you're tired again, go back to sleep And make sure you have your sound therapy that works for you set up. Make sure that you're feeling comfortable. Make sure the lights are low and you're relaxed, and then try to fall asleep. Most people are able to go back to sleep using that method. So that is the one major tip I want you to leave this video with. And let me know in the comments below if you have any follow-up questions for me and my team at Treble Health about sleep and sleep techniques. I'll be glad to check those out and answer them. And of course, if you'd prefer a one-on-one conversation with someone on our team, take advantage of our free consultation, which can be found on our website. Thank you so much. And my name is Dr. Ben Thompson. I hope this video helped you get more techniques and tips to push you through those troubles that can come when you're trying to fall asleep with tinnitus. This is not easy. This is not a quick fix, but let me reassure you that when you have the proper guidance, your brain through neuroplasticity can improve and reduce and defocus from the tinnitus to a point where it's less perceptible. You're thinking about it and hearing it much less during your day, and oftentimes the volume can shift and reduce as well. Focus, do what you can, work hard at this, and reach out if you need help. This is Dr. Ben with Treble Health, signing off. Bye-bye.